It's my,
Oh, your buttocks?
yes, my left
Oh,
one.
that's iliac. That's iliac claudication.
Hey everyone, welcome to another PAD test breakdown. We have Sharon with us today, and of course, our amazing world-renowned RVT Denise Levy, who is going to walk us in the door to a consult with Sharon, how she normally talks to patients before she performs any PAD testing, so we can learn a little bit more. And we're not here to diagnose. We don't diagnose. We're just here to help patients understand their results so they can ask better questions. We even help with questions, don't we, Denise?
Yes.
So why don't we walk in the door and get the backstory from Sharon before we
Okay.
start looking at her results?
Okay. Sharon, you're non-diabetic, correct?
Correct.
Correct. And you have a history of smoking.
Yes.
And how long did you smoke? More than 10 years?
40 years.
Okay. And so that's a risk factor for you.
Yes.
And I've looked at your exams, and even the one that is post-op. So it does show that you still have some disease. And we categorize it by looking at the arm and comparing it to the leg. And what it shows is the waveforms from your first test and this one, they're monophasic, which means there's disease above, which is causing the waveform to change from 3 components to 1, so that it shows disease downstream. So what we can gather from this is that the disease, as it goes down, becomes worse. The vessels become smaller, particularly in your foot. So that another scan would be helpful, other than
So
the
is this
ABI.
post procedure? Is this post procedure?
This is post procedure. Yes.
Oh, wow. Okay. So
And
we talk about
Sharon, we don't
procedures.
have any stents, no stents in your leg.
No stents.
That's interesting that they didn't
she
stent
had,
it.
okay, no, but they did the common femoral endarterectomy with a little angioplasty, is what it sounds like, a hybrid procedure.
Yes. Yes.
Oh, they
Okay,
did common
in both
femoral?
legs.
I thought they did femoral, superficial femoral.
Did they do this? Was it the thigh or was it your bendy spot?
It was the groin, the bendy spot, I think you're calling it. You know, the underwear line on both sides. Is that
Well,
what you
that's
call
where they
bendy?
go in, but that doesn't mean that that's where they treated. So it would be good to have the angio report.
I do
would be
have
very-
that. I didn't upload the op report or the angie. I didn't
That's
I didn't
very
know what-
important.
I'm
Yeah,
sorry.
that it's very important to have that,
Oh,
Yeah.
okay.
because then we know what's open in your calf, how severe is it, and did they balloon they always balloon angioplasty after atherectomy. The atherectomy is a device that rotor
Oh,
roots out
she had
the
an
plaque.
endarterectomy. She had the endarterectomy.
Yeah.
Yeah.
So she actually had it carved out.
Yes. Rotor rooted, they said.
Oh, wait, so it was not an endarterectomy? They didn't slit down and then scrape out the plaque? They just did atherectomy? Did I misunderstand?
No, I just maybe it was a resident that said rotor root, but that's what you just said is what I thought they did. They opened it up. He showed
Right.
me a picture on his cell phone of the big hunk of rust he got out of it, and stitched it up and put the little patch on it.
Right.
Okay, so he did an endarterectomy, but he might have also, so they
We
call it
don't
a
know where.
hybrid approach. But it sounds like the CFA, and then what they do is they go down into the SFA and they do a little atherectomy, little roto-rooting balloon, but they didn't place stents. but they did not touch below the knee. So how we phrase it is they turned on the faucet, and which is normal, right? They got the blood flowing up top, which is great. You got the inflow going. And they were hoping that maybe once they turned on the inflow, that maybe the plumbing below would sort itself out. Maybe it would populate, maybe more collateral vessels would grow with every step, because they don't want to treat the below knee arteries right away. That's just a revolving door over and over and over again of procedures. So
Right.
they steer away from that early on. If you could walk, grow those collateral vessels. But if you're still having pain, you end up with wounds on your foot that are not healing, then it's important to know, okay, doctor, do you, when medically appropriate, when there are wounds that aren't healing, do you know how to take a wire and balloon into those small vessels and finesse your way through to open them up, clear down to the foot?
Okay, I wrote all that down. Okay, vessels 2 foot. Okay.
But right now it looks like, as Denise said, some monophasic, so still some sluggish flow going down below the knee,
Okay.
according to this post. Denise?
Yes, it's still moderate. She's got 0.59 and 0.56, which is still moderate disease. And then the inflow coming in, if you look at the waveform, it says monophasic, which
Okay.
means
Oh,
that there's disease above that area.
still, okay.
So did you have a scan 6 weeks after your procedure, your operation?
s- what kind of, like an MRI or an
No,
ultrasound?
we just do an ultrasound scan within 6 weeks of having an angiogram. Just make sure that everything is open and
Mhm.
that it did not reclose.
Okay, no, I don't see any of that. He just had me come in to his office and he had his tech do the ABI. And so he didn't send me over for ultrasounds or anything.
Oh,
So it looks like that would have helped us, right?
yes. I
Well,
would like to know what's going on with the inflow at your groin, because it says it's monophasic, which means that there's inflow disease above that, which would be iliac.
Interesting.
Yeah,
so that's closer to the stomach, right?
Yep.
correct,
And-
correct.
Denise, we've had this quite a bit. I can't,
Oh, yes.
I don't even think,
Yes.
she has told quite a few people, which literally shocks the heck out of me, that no one's checking the inflow, no one's checking the aorta and iliac. I don't understand. Well,
I
there are
don't
people
either.
doing it, but we've had so many that aren't.
Yeah, and it's so beneficial because it's such a big vessel. It's twice the
Yeah.
size of a common femoral. It's twice the size of a superficial femoral going down your leg. So if you fix the iliac, you've really got a better inflow, is very beneficial to the entire leg.
Boy.
Yeah.
Yeah, so this might be worth a second opinion.
And
What do you
and
think, Denise?
usually we always check within 6 weeks, because if anything closes after 6 weeks, you usually can't fix it very well. It becomes hard. The but if it thromboses, where you had the balloon angioplasty, then they can reopen it if it's soft. So that's why we do it.
Oh, well, I wish he would have done that.
No,
I know, and in retrospect, and I guess to Kym, in walking and building collaterals, will that help this up above and down below, or is it too far up in the iliac to
Well,
benefit from walking?
it's hard to know. It would be good to have the angio report.
Okay.
So we would know, is the entire superficial femoral artery occluded, or did they just, it sounds like they opened something, in the artery if they did atherectomy. And usually they do a balloon, and usually they stent it to keep it open.
Oh,
Um,
well, I guess
But
I
that's-
was grateful that he didn't stent. I've heard nightmares from people about stents. You
well,
know, you
not
go to-
always. Not always.
Mm.
It really depends on the patient.
Okay, and I'm gonna walk till I, yeah, I'm
How
not
far
getting.
can you walk? How far can you walk right now? How are you doing in terms of walking? Because that determines whether or not you should or shouldn't be treated, you know, at this point, your symptoms that are deterring you from walking.
Yeah, because
20 minutes, half an hour. Once I started on the treadmill, because our weather's so horrendous, I'm at Planet Fitness. After 2 or 3 weeks on the treadmill, 4 times a week, my hip and glute on the left side, the bad leg, that's what stops me, not claudication in my calves. It's my,
your buttocks?
yes, my left
Oh,
one.
that's iliac. That's iliac claudication.
Oh God. Well,
Oh
can
my
walking
goodness,
help that?
Denise, you're nailing it again.
I was asking, where's your claudication, calf, thigh, or buttocks? Buttocks is definitely iliac.
Yeah, it's just one side, the left leg, the one he said he
Yep.
didn't do what he wanted to do. So can iliac be, oh God, please say yes. Through walking and continued diet, what have you, can iliac benefit from that? Well,
It can
that
benefit, but that's not the place. Usually they like to treat that because they're really big arteries. And you could feel a whole bunch of relief if they just go in with a little bit of a balloon. Maybe they have a shockwave device, I think, at your hospital system, even that can crack some of the plaque,
Yeah.
and they'll stent that because that's durable. If you're not smoking anymore, that's durable. And I bet you your doctor, I would ask him because I'm wondering if that was what he was talking about, that he was like, I could do a little more in a minimally invasive way. That would be worth asking him.
Okay. So
Definitely.
it's like my iliac, because yeah, my calves hurt sometimes and they never hurt before the 2 surgeries. It's weird, but but the worst part that keeps me from walking, and with my glute and that left hip that hurts so bad, I stop. I can stop and take a minute and it goes right away. So
So do you have to stop after 5 minutes?
no, I can go probably 20.
Okay.
Well, that's
Be-
good.
Yeah,
Yeah.
that's really
good.
good. So you
Yeah.
may not need treated right away, and you,
Oh,
Yeah.
you know, just keep
And
pushing.
if you recover within a minute, that's good too.
Okay.
Some
Oh, I
people
love
don't
hearing.
recover for 10 minutes.
No,
But
I'm
if you can walk
surprised.
again in 1 minute, that's pretty good.
Yeah, I'm surprised, and I was thinking it was going to get worse, but it doesn't. It's that just stop, just go 20 minutes and stop, let it pass, and get right back at it. So, oh,
Good
I'm
for
so
you. Well,
thankful for both of you so much.
yeah, it sounds like you're on
It's
the
so
right track. Let
scary.
us know. It's nice when you can go back to your doctor with some really great questions to ask, but
Yes.
you're a poster child of what you should be doing, getting out there, trying to be the best partner in care, not being procedure forward and expecting, you know, others to do the work for you. You're doing the work, but you know, it's worth asking the doctor, making sure what's going on, even just to know if your iliac is open, if your aorta is open, and if you're walking, you know, ends up getting reduced, that's a conversation to again have with the doctor to say, hey, you know, is it the iliac? Can you maybe open that up just a little bit? Give me a little more flow so I can walk further without pain. But even more, we always suggest a second opinion to understand more options. But come back to us, let us know, email us at info@padhelp.org, and send a few more of your
Please.
details with explicit permission to share with Denise. But thanks everyone for joining us. Make sure you like the video, subscribe to our channel, and you too can send your test results to info@padhelp.org with explicit permission to to share with Denise, and so you can participate in this great discussion. Thanks everyone for joining us.
Thank you, Denise. Thank you, Kim.
You.